coming on. My name is Beth, and so Serdentity is a word I made up. It's a combination of serenity and dentistry. I have been talking about dental fear for 30 years, but it wasn't until I started learning about the airway that I put it together that, dental trauma starts with the airway. Patients get traumatized in the dental chair because they can't breathe.
I'll go back a step on that one.
Go ahead.
So, from my point of view, that one actually starts with the suck, swallow, breathe reflex and the beginnings of tongue tie that start at 5 weeks in utero.
Oh, okay. All right. So let me start recording because we're going to get right on this, honey.
Yeah.
Because people, you're exactly right. They don't know. And, dental professionals complain a lot about patients that don't know how to act in the chair. But the reason that they don't know how to act is because they can't breathe and they can't breathe, suck, swallow.
Yeah.
They never had to learn that because,
Absolutely.
Fed and yeah. So we just basically poured the food down their gullet. All right, so we'll do a little quick intro here. So you're a chiropractor. Do you have a bunch of letters after your name?
Yeah, I do.
What are they?
So obviously I have a chiropractic degree. I have postgraduate in functional neurology. I'm a fellow of the Australasian College of Nutritional Environmental Medicine. I have a master's in nutrition medicine, as well as my original bachelor's degree in biochemistry and physiology.
Holy cannoli!
Yeah.
So I'm just going to introduce you as you're like wicked smart and you have a whole bunch of degrees.
and then we can get them to read my book and figure that one out.
Yes! So how long have you been in the whole airway tongue tie thing?
I don't know, slowly and more steadily for about 5 years.
Okay.
And I've just kind of continued. So there's a backstory to why I do everything that I do, I suppose, and we can get to that.
Oh, well, good. We'll get that straight out of the gate.
Yeah.
Hello, everybody, and welcome to another episode of the Serdentity podcast. I am your hostess, Elizabeth Dewar Anthony, and I am so thrilled to have this man with me. He's in Australia, people. He's literally on the other side of the world. This is so exciting. And he's a chiropractor, but he's got a whole bunch of other degrees. He's wicked smart. And he also wrote a book. So this is Dr. Scott Wustenberg, and we are going to have a great conversation. Welcome to my podcast.
Thank you very much, Beth. It's great to be here.
So tell me about yourself.
Well, my star sign is Capricorn, and I like long walks on the beach.
I like you already.
Yeah, it's going to go downhill from here.
I'm a Gemini. We're not really,
No. But we'll make it work. One of your personalities has got to gel with mine for the day. So I'm a chiropractor first and foremost. My original degree was biochem and physiology. I then completed my bachelor's degree in the first graduating class out of the New Zealand School of Chiropractic. I have a family history. I'm about the fifth chiropractor in the family, and so we had a specific bent towards sacro-occipital technique as brought to the region by my uncle, who studied directly under Dr. Major DeJeanette, who was the developer of, sacro-occipital technique, cranial work, TMJ work, etc. So that kind of led me to a bunch of different things, and then my children, including my eldest daughter, she jumped off the planet into the land of autism at about 18 months of age after being very neurotypical, fast for all the developmental milestones, and unfortunately at that stage I really had no idea what I was actually looking at or dealing with. So we tried chiropractic to help get her back on, and that did diddly squat to help her, even with all the information I had to hand. So I started to retrain myself and retool myself, and I went to things like Defeat Autism Now, and I retrained towards being an integrative doctor. I've got a fellowship in functional environmental medicine and nutritional medicine. I have a master's in nutrition medicine, and we looked at things for a while and reclaimed it very steadily over a period of time with nutrition medicine. And the problem that I found is that you just upregulate. Oh, we found this thing, we've done this test, here's some more B vitamins, here's some more of this, and you just keep loading more and more things into the system to try and add balance to the resources. Now, after a while, I kind of went, this isn't really working, and I went back to my more chiropractic roots and retrained in functional neurorehabilitation with the Carrick Institute, who's based in the States. And I owe a debt of gratitude to Professor Ted Carrick for his lifetime of work to help me understand that it's really, and in all things, including the airway, it's the brain that's in charge, and everything is done based on survival, right? So the brain does everything for your best survival. And so we then did that for a while, and that helped, and she got a whole bunch better. And then I worked out, along with all the functional orthodontic work and trying to expand things, that all the brilliant people along the way had been missing my kids' tongue ties, my own tongue tie, etc. And that led to a whole bunch of interesting kind of rabbit holes to try and figure out how all of that actually comes together. And there's a hierarchy to it all, and I, of course, am a very disagreeable character, that I disagree with most of the people in the field, because I'll say, this thing's the most important, and I'm like, no, that's not how it is. So there's a basic kind of snapshot of where I've spent my last 20-odd years in a moment.
Wow. That's great. So, a lot of us come to these sorts of fields out of necessity. Somebody in our family is suffering.
Yeah.
And we're not getting answers from traditional medicine. So we have to go looking for them. And I love what you said about the brain, and that's what I've been saying for a long time. This is what I tell my patients. The patient will have a gag reflex, and they're all ashamed about it. They're apologizing.
Yeah.
And I tell them, look, your brain doesn't care, all right, that I need to get these x-rays. Your brain is going to breathe, and if I put something in your mouth and block your airway, your brain's like, nope, not happening, and out it goes.
Yes.
So you are not doing this on purpose.
No, that's exactly it. And in that particular instance, there is a whole lot of interesting things with retained primitive reflexes. That is what my main features of lecturing is about at this moment in time. Trying to get people to understand that it's actually starts with the tongue, it starts with the suck, swallow, breathe reflex, but all of that actually starts somewhere around 3 to 5 weeks in utero.
Wow.
Okay, so the latest lecture that I've written, and I'm having done up by my assistant, so I'll put it out into the world very soon, is on the negative impacts of phthalates, PCBs, plastics. So the lining inside your takeaway plastic coffee cup is probably murdering you, and it's strongly associated with issues with MTHFR, which is strongly associated from an epigenetic point of view by 3 weeks in utero with causing the problems of midline structures, tongue tie, oral airway functional maldevelopment syndrome. So by 5 weeks, the tongue, the maxilla, mandible, etc. is already built, and all those problems are already built in, and phthalates and PCBs will block your folate's ability to actually strengthen the tissue and cause the actual chiseling away of all the excess fascia. So it's the pre-exposures in mum and dad that actually cause problems. And so the men don't get away with this because, again, the methyl tags actually get picked up as the ejaculate leaves the vas deferens and the penis on the way out to make mum pregnant. So if you've got too much chemical load, PCBs, phthalates, etc., you are screwing up your ability to make the placenta work properly and feed blood supply to mum's system, which activates a reflex called the fear paralysis reflex. So the more under threat mum's system is while she's pregnant with a child, the more it diverts the blood supply away from the placenta and the baby, leaving the child automatically under threat load, driving mum into survival state so that she can get past whatever the day-to-day threat is. And this stops you putting nourishment into the child, making for a maldeveloped system. And all of this starts as midline structures. Getting worse, by 20 weeks, all of that tension on the midline structure, cheekbones, tongue, nasal passages, jaw, is now activated and entwined with the suck, swallow, breathe reflex. So you will spend the next 20 weeks of your pregnancy maladaptively learning to develop a thrive or die response. If you do not activate some form of appropriate suck, swallow, breathe mechanism. Now the breathe comes later. It only starts obviously immediately after birth. But the suck, swallow has to be practicing for like 20 weeks.
Yes.
Now, fortunately, Dr. Kevin Boyd, who's in Chicago, is a pediatric specialist dentist.
Oh, I know Dr.
Yeah.
Boyd.
So he turned up at a seminar that I was lecturing in May in Melbourne. So I did my presentation on the Saturday, and he turned up and presented on the Sunday, and all of his work basically was showing when is it appropriate to intervene? And he just confirmed everything I just said. By 21 weeks on his ultrasound, we're already seeing the protrusion of the maxilla. We've already got the tension of the fascia pulling down and not allowing that mechanism to actually adapt. So all of this hypersensitivity in the mouth, the gag reflexes, etc., are a neurodevelopmental disorder created by a bunch of stuff. It's not just the plastics. It's not just the PCBs. There's a bunch of other stuff that goes into it. But those are the really interesting ones that we can do something about. We can get rid of the seed oils, which are infinitely toxic and screw up your methylation as well. We can get rid of these plastics that are unnecessary in our environment, and we can start creating better humans. Because otherwise, we're going to see more and more people with maldevelopment, retrusion of the jaw, poor tongue movement, and that will end up being seen in the dentist chair at some point. And what I talk about in my book is that this is a continuum. It starts at one point, and you can track every one of the developmental faults through till you get severe apnea and start getting dementia as a 50 to 60-year-old.
Wowie wow. So there's so many things I want to comment about.
Right.
The retained reflexes.
Sure.
I learned a little bit about those as part of my education in orofacial myofunctional therapy.
Yep.
And I was doing nursing home dental hygiene.
Yeah.
So what I realized is that I would touch a person with a degenerated brain.
Yeah.
I would touch their lips, and they would automatically pucker, and they would turn up.
Yeah. Rooting reflex.
Yes. So I put those puzzle pieces together. I was like, oh, they are reverting back to infantile reflexes.
So that raises a really interesting question, because there's two ways of looking at that. One is that the frontal demise that's going on is because the frontal lobes inhibit and hold in stasis all the primitive reflexes. So the more you develop your brain from childhood, the more you inhibit those pathways, but they're never gone. They're always there, and they're the layer underneath all of our adult behaviors, reflexes, etc. When the frontal lobes demise, with whichever disease that they're showing up, the brain cannot inhibit those reflexes anymore, and that is called a frontal release sign. Technically not a primitive reflex, right? But what we don't do is we do not check appropriately for children having passed through their developmental milestones to make sure they have not actually still having the retained primitive reflexes. So the question then becomes, are the retained primitive reflexes still there that lead to the demise of the brain in the first place? And the reason why is things like tongue tie and what I call oral airway functional maldevelopment syndrome occludes the airway, especially at night, and especially leading to fragmentation of sleep. So the more you fragment your airway and the more you fragment your sleep, the more you stay in a survival fight flight mode, and you never develop the normal pathways in the first place. Now, fragmentation of sleep will cause dementia. Fragmentation of airway and low oxygen will cause dementia. So what we're kind of doing is we're saying, oh, this person's developed a problem later on over here, right? And then we're seeing signs of the frontal lobes demising. But it's because I think we've done a terrible job in this intervening space looking at making functional humans. And lots of these people are running around with tongue ties and lip ties and all those things. Now, I talk about tongue ties because they're the most obvious tip of the iceberg. It's a whole lot more than that. But people kind of can see a tongue tie and a lip tie and they can go, oh, right, I see it. But where I think we're really failing is mid-body tongue restrictions, or posterior tongue ties as they used to be called, because they can poke the tongue out, right? Oh, they don't have a tongue tie, right? But that's going to cause this wonderful tongue thrust, which ends up at the orthodontist with kind of beaking, inappropriate bite structures. But it's really what's occurring when they're asleep. And as that airway gets occluded, as they go into REM phase sleep, your brain has to wake you up because you cannot breathe. And what happens if you fail to take your next breath?
You're dead.
Yeah. So the brain really, really likes not being dead. And therefore, all of your thought processes, all of your behaviors are predicated purely on survival. Same thing with the suck, swallow, breathe. If you can't suck and swallow appropriately, you have to find a mechanism. And that mechanism is chomping. It's like, who knows what you're going to do. You're going to aerophage and suck down too much air because you can't get proper suctions, etc. And that's going to cause positing. And all of that's associated with eczema, asthma, dermatitis, silent reflux. And all of that continues down this pathway. And it leaves a child full of cortisol and adrenaline and unhappy with a hypersensitive oral structure, because the tongue is your first sensory tool and it's meant to teach you about the world and drive every one of the other primitive reflexes. And as I lecture about, the tongue is essential for the release of oxytocin and wiring up your ability to calm and connect with people. It's also essential for wiring your mechanisms, such as the serotonergic release and the dopaminergic release, to keep you focused, concentrated, and happy doing stuff in a productive fashion. So if your tongue doesn't move properly from at least 20 weeks in utero, you are less inclined to make a normal developmental system. And this looks like ADHD and ASD disorders.
Wow. And dental people have a very poor understanding of what the tongue is. And I'm really glad that you're saying all this, because when the three people that are listening, hear this, they're going to be like, wow, the dental people, we look at tongues like there's something that's in the way,
Well, they will be if you're a suck, swallow, breathe that's really hyperactive and you've got this, get it down.
Yeah. So in my lecture, I'm talking to dental people.
Yes.
And I'm talking to, your run-of-the-mill dental people that don't have a lot of education in all the stuff that you're talking about. And, trying to get across to them that when patients can't breathe, then they're going to present in way, a lot of times they present as hostile, belligerent, angry, because they're expecting to be
threatened,
struggling to breathe.
Correct.
And the tongue. So I was telling, I include some information about the tongue, and you just gave me a whole lot more. That the tongue is an organ. It's really, really important, and we have to stop looking at it as something that's getting in the way of me fixing these teeth. We have to stop thinking about fixing the teeth, and let's start talking about growing healthy humans. So you've just pretty much blown me away with everything you've talked about so far.
Well, thank you. So from my point of view, teeth are an after function in this whole thing. You have to have the tongue and the nervous system operating to drive the bone structure to develop appropriately. And again, lots of the ortho stuff, and I have arguments with a bunch of people, including, like I've commented about a failure in the orthotropic concepts out there, because again, Professor Mew looks at it that you can just exercise the fascia into flopsiness and it'll all fix if you kind of get it mobilized appropriately and just do enough breastfeeding. I've read his commentaries on this. And again, I disagree with that. That is not how the thing works. And he's looking at it and doing good work and mobilizing face and teaching people, but they're all thinking about it as we're just exercising muscle. Now, my concept for you is, you've seen a piece of rump steak on a plate, right? Right? What does it do?
Yep. Nothing. Just sits there.
Sits there. Why?
Because it's been detached from all the nerves.
Correct. So without the nerve, the muscle does nothing. So all of our exercise and activities in myotherapy and myofunctional activation, these are all neurological drivers of the system. And they are all layered on top of your primitive reflexes. And if you have retained primitive reflexes because your airway is being occluded every night you go to sleep, you will go 2 steps forward and 1 to 2 steps backwards on a daily basis. And until you get that airway clear, and like, I'm an interventionist. This is when I saw Serdentity, I went, oh, that's like, I'm traumatic. I'm the exact opposite. I'm saying you should get laser reduction on that thing. I was mildly panicky that I was going to be not the right. But my concept is you have to take the brain out of threat. To do that, you have to have a patent airway. Now, that's for whatever reason. Do we have established sinus breathing? Yes, no. If you don't, you have to fix it. Do we have a tongue that is not moving appropriately, is being restricted, hampering airway? If so, you have to fix it. From there, in a child, if we do this early enough, we grow a better bite structure. But again, my observation is people who've had work done at like 1-2 years of age, they've had their tongue tie release and everyone's gone, yay, we're clever, we fixed it. Go away. They end up in my practice at 14 years of age with very, very bad bite structures because there's still restriction, and because they are not cognitive enough necessarily and the parents aren't taught to, they do their exercises for a few weeks and all looks fine, and then they just leave them alone to develop. But it's a neurological biochemical disturbance. So the neurology has been developing since 5 weeks of age in utero. Okay? So you've had, by 2 years of age, a really, really, really 99% of your life not using it right to that point. Do you think I just released it, it's magic. Magic!
Right.
It doesn't work that way. You have to keep doing activation and purposeful movement for a really, really, really long period of time. And this is one of the reasons why I have down here in Australia, I import the replenish straws, right? Because
love the replenish straw.
This is purposeful movement to activate the suck, swallow, breathe mechanism. You need to be keeping the tongue going through these activations. I also recommend people learn to play the trumpet. So it's the trumpet, trombone, it's the brass instruments because they have an up and forward activation of the tongue.
Okay.
Lip is an orbicularis oris closure. You are doing, so all the other ones like flute is an open mouth, pursed lip. The woodwinds are broken lip seals. So trumpet playing is a purposeful movement that will activate the tongue.
How about the didgeridoo? I'm always hearing about that.
I don't know enough about it, even though I'm here. From a theoretical point of view, it's very good for driving what's called a circular breathing pattern and increasing nasal airflow. So I think it'll do really good things, but I don't know so much about what the lip seal and the tongue is doing. All I know is I'm terrible at playing it myself. And
oh my gosh. So I want to talk about, in myofunctional therapy, we do talk about neural re-education.
Sure.
And you know, we have most patients are on a 1 year treatment schedule where you meet regularly once a week for 8 to 10 weeks, and then you start to space it out. And by the end of the year, you're meeting monthly. We're trying to, get these neural pathways, grooved in.
Yeah.
And hopefully the patient is going to
So my experience with this, because I see a lot of adult tongue ties looking at their airway occlusions and apneas and hypopneas, etc. And what you find is that you do the myotherapy, the intensive course and release, and get them doing these things. But by about the year mark, they're fairly bored with the basic myotherapy exercises. And what occurs is after that, they stop doing them. Generally, they're not very keen on it after about 4 months. Sometimes you can get them to 6 regularly, right? So they get bored. That's normal for the brain. The brain requires novelty, and it requires stimulus, and it requires purposeful activity to buy in to keep doing something, right? So post about a year or so, their symptoms start to occur, because when you leave something to chaos long enough, it reverts back to its mean state, which is bad, right? So if we're seeing this as a 55-year-old who's been dysfunctionally breathing for 55 years, and we then do some work for a year and then they get bored, they have 55 years compared to 1 year. Where are they going to fall back to?
Right, to the 55. So, wow. So should we have everybody playing the trumpet?
Well, maybe not everyone playing the trumpet, but you can give them the different parts of the brass section. So the answer to it is that we need to do better with finding purposeful activity. So again, it's why we here at Optimal Sleep Airway Health import the Replenish straws for both the kids and the adults. They're obviously available in the States. Anyone should be able to get a hold of them, because that is a purposeful activity. Trumpet is another purposeful activity. Blowing up balloons is a purposeful activity, but you can't do it all the time, right? So it's trying to give them activities. And again, everyone has to drink water on a daily basis. So why not do it for a purpose to keep that tongue actually moving with tone? Because if you don't keep it toned and up, and when not in use, against the roof of the mouth, where is it going to fall? And so the problem isn't when people are awake. Everyone forgets, oh, look, it's doing fine. I don't have any problems when I'm awake. I'm breathing really well. It's when you're asleep and you are running on that innate nervous system, and it will push you into a sympathetic response. It will fragment your REM sleep, because there is a link going back to your fear paralysis reflex. The fear paralysis reflex turns into the Moro reflex and the startle response in the children, which should develop into a Strauss response as an adult. But there is a part of that fear paralysis reflex that turns into the controller of airway in REM sleep. And if you are not functioning well in that area when you're in REM sleep and you over paralyze, what happens to your air?
You can't breathe.
That's where the nightmares occur. That's where the sleep paralysis occurs, because you had to wake yourself up because your airway occluded, and we then get stuck because we're still in REM. And it's a neurological development since 5 weeks in utero. This is the fun conversations I had with JJ.
And he's so dear.
He is.
I hope I didn't sound like too much of an idiot when I was talking to, just like right now. And
Well, he's a super bright, very, very kind human who wants the best for his patients. And he's just so open to learning new things. So I love him dearly.
I don't actually have a problem looking stupid, because, I'm a musician, and when you play with people who are better than you, you rise up to their level.
That's it.
So, it doesn't really bother me if I look,
I try and work to find the smartest people in the room, and hence meeting JJ at the MyoFocus Symposium in May. Shameless plug for MyoFocus. It will be in Malaysia next May. So whoever is listening who wants a nice educational holiday to a tropical island paradise, next May in Malaysia. MyoFocus Symposium. It's a conglomeration of chiropractors, osteopaths, airway focused dentists, orthodontists, people like JJ who are doing amazing things, trying to educate us to work together and actually become a unit that we're working towards the patient's best health and well-being, not just, look, I did a tongue tie release, you're fine, go away.
Mm-hmm. Well, this is also comprehensive, and modern life, we're just not, we're living the opposite of what we're built for.
Yeah.
Which is, that's why there's disease. And it's, at some point it becomes like overwhelming.
Oh yeah, we could start down this rabbit hole if you want. We can talk about the LED blue light effect screwing up your vitamin D receptors, which screw up your REM sleep phase. So electromagnetic fields will bend the structure of the receptor because all of the proteins that make the receptor. So think of it this way: you have a structure. Each one of these things is an amino acid. All amino acids are polar. They have a positive or a negative charge to make it hold the shape, right? So they have to have a shape that the vitamin D can actually bind to then activate the cascade that neurologically puts you into sleep. Electromagnetic fields from things like blue light, from things like garage door opener, the 2.4 gigahertz frequency of a garage door opener, the Wi-Fi frequency of about 6 gigahertz bends this.
Oh my gosh.
So if you bend it, your vitamin D cannot bind to this thing and you cannot activate REM sleep. So what happens to you is that you slowly go mad. And what are we seeing? Depression, anxiety, emotional disorders. Mm-hmm. But you can get all of that from respiratory failure. You can get all of those disturbances will occur because you are tongue-tie, oral airway functional maldevelopment, including your airway. Fragmenting your airway will decrease oxygen supply to the brain, creating these problems because inflammation from chronic airway occlusion will drive your serotonergic receptors to die off, and so you can't have as much serotonin reception to keep your mood and personality up. Further to that, though, the more you fragment your sleep because your airway occludes, because you had to wake up, the more flat of affect your mood becomes. So the world we're playing in with the massive amount of electromagnetic fields is not real good for us. So you are right on the money there with the world we're living in doesn't work, notwithstanding those bloody cups of coffee that are in those wonderful styrofoam and takeaway coffee cups. I didn't mention the worst part. For all those people who really want to scare themselves, those chemicals, the phthalates, are shown to cause a decline in penis size in your offspring.
Oh my God!
Right?
Now you got somebody's attention.
That is a serious. Like we're like all of the politicians out there keep talking about we're overpopulated. We're in a massive population implosion. You are not having enough children being born. Here in Australia, we're at 1.6 children being born per viable female, right? Mm-hmm. To stabilize a population, you need 2.2 children or greater to actually maintain your population average, not grow, just to not die as a species, right? Phthalates, PCBs, all the Teflon stuffs, they've known for years that these things were fragmenting sperm quality, declining sperm count, shrinking penis size, and actually creating what's called a reduction in the genitoanal gap. So the space has gotten smaller, which means that the male children are being feminized or demasculinized, and so it's much harder to get someone pregnant if your machinery isn't very efficient.
Right. So in 10,000 years, we're all going to be female, and we're all going to be like, have this forward head posture. We're all going to be like this.
I think you're being kind. If we keep going at our current rate.
If we survive, that's right. If we survive. And, there's always, the big red button too. So,
well,
if somebody gets access to that, and then maybe it'll be like a clean slate.
Well, that's kind of what the crazy people out there seem to be doing. Like I don't have a lot of faith in any of the politicians on either side of that. None of them seem to be focusing on human flourishing, and all of it is at the behest of politics and commerce. It's all economics. We could change so many of these things, but we just don't. Right? Instead, what we're doing is we're spending the money on treatments like drugs and surgeries and fixing it here, not going, hang on a tick. We know, and we've known for like 50 years, that these chemicals are bad. Yet we keep addicting people. Like plastics everywhere. Everywhere. And all of them give off toxins that go through your skin. All of them. We're not getting out of this alive is the simplest thing. But we're meant to be looking for, how do we make greater humans? How do we impact them? How do we make them breathe effectively? And again, if we go back to where we started, everything starts with the tongue. Everything starts from there about connection. The suck, swallow, breathe reflex then drives the tonic labyrinthine reflex, which then drives the asymmetric tonic neck reflex, which helps drive us to connect, look up at mum, begin to know our left and right, and develop functional movements. If that tongue doesn't work, the brain doesn't work, and our ability to stare you in the eyes, know that you've got my back, and connect to you is traumatized, which means that the child does not drive an appropriate ability to be able to read faces and connect. Now, it's not 100%. It's not like, bang, everyone's exactly the same. But this is what's occurring from oral airway functional maldevelopment. The tongue, airway, bite structures, etc. are neurologically active tissues that wire us up, and it's wired by movement. You don't move it effectively, you don't move the body enough, you don't develop enough muscle tone, you don't develop enough of these up-down movements, left-right movements. You do not wire your brain for success in the same way. Now, these kids get to school, they get to kindergarten, as you'd call it, and they don't have good handwriting capacity. They don't know their left and rights. They don't know how to climb a tree properly. They don't do any of these things because their bodies are not developing.
Right.
As that goes on, because they do not have the ability to stare people in the face appropriately and understand what your facial expressions are saying, we then start diagnosing them with the alphabet soup of conditions. Because
we're slap a label. They're neurodivergent. They're Asperger's.
But that doesn't help them because it's a box. Oh, you're in box Johnny. You're in we need a mechanism. And so oral airway functional maldevelopment syndrome says that fragmentation of sleep and airway because of a bunch of these things over here, including traumatic birth. We haven't even got to that one yet. So all the traumatic births, including C-section, von Teuse deliveries, forceps deliveries, etc., all drive a greater impact on developing facial destruction. So you pull on someone's head, you are going to make an adenoidal face because you are taking the normal angles and you are elongating them and leaving them stuck in that position, right? So think of how everything is about the angles and the position and the skull and the brain. The brain all fits neatly into packets inside the dural membranes in the skull. You pull on that, you are changing how that brain communicates. Everything has to change its angle to the central processing units. This changes the speed of which communication occurs in there. It changes the position of the eyes. If we pull on this head or twist it or create plagiocephaly, the eyes which have to be on the horizon looking forward are now in a different spot. So you have to change your position to keep the eyes on the horizontal looking forward, which develops scoliosis of the spine.
And that's what we see, when we're doing an evaluation. I just saw a girl today, so twisted, and her eyes were canted down. So Yes. And so in order to, she's got to go like this because I'm thinking of like an airplane. Where did I go? I'm thinking of an airplane,
Yeah.
Where the plane's got to be like this. Wow. I just,
Yeah. You can't move that much.
right with this background. So, wow.
So what that will then do, of course, is the eyes here are built on top of this. Okay, so if the upper section of the bite is becoming deep and shortened and poking, you're going to get the eyes, instead of being level, starting to do this, which causes counter rotation outwards, which changes the focus. Now that means you're not going to have the right focal distance to know where you are in space. Your body map of where you are in relationship to everything else will change. Now, you'll end up with glasses at that moment in time, which seems to also be particularly common. But what people generally don't know is to focus on something, to hit the target, requires the release of cortisol to tighten your pupils. So the harder it is for you to stare at something, the more cortisol you have to squirt into the eye tissue and therefore the system to actually hit the damn target. So we are constantly altering ourselves to upregulate stress responses, threat responses. Because again, what's the purpose of the eye? People go, it's to see stuff, right? No, it's very simple. Object coming towards me. What is it? Where is it? Will it get me? That's it. That's what the eye is for. Second would be, what is it? Can I eat it? Right? Survival basis. So if you are struggling to hit the target because your head is doing this, you have to alter yourself, change your body position, and tighten up that focus and drive a wider peripheral gaze, which is why they talk about kids on the spectrum having these eye movement patterns that are looking from the peripheral. Of course they are. They are hypervigilant because their system has been maladapting since 3 to 5 weeks in utero, and every system has had to alter to compensate to drive their survival response. And if they use a peripheral gaze, they get to see more information to determine what is it, will it get me? And that...
So,
yeah.
Modern life is just too easy. Early humans wouldn't have survived with any of this.
No.
So,
they wouldn't.
Yeah, modern life has become too physically easy.
Yes, agreed. We don't, like, what we've done in our Western society is we've increased the supposed importance of didactic learning and staring at a box, etc. Learning factoids, not moving. You learn by moving. So the entire brain is set up by learning by moving. The first kind of 6-12 months of your life is you learn everything because you rolled and tumbled, etc., etc. Those pathways are still what make most of us move to learn. So the kids that are not sitting still that we want to medicate because we say they're ADHD are trying to adapt to make their system learn effectively, because they hear someone say, you must do this, and to make that occur, they are using their reflexes to jiggle their brain into motion at a basic level, right?
That's amazing. I never thought about it that way. And I'm also thinking about, higher brain function and emotional intelligence, right? And how is anybody supposed to have any amount of, we're hardwired to connect with each other.
Absolutely. Starts with the tongue.
And
That's
so
the first latch.
How is that supposed to work if everything's all double twisted up?
Correct. And again, suck, swallow, breathe doesn't work. Oral hypersensitivity, can't latch appropriately, can't drive oxytocin, which is the love drug, so to speak, the connection drug. So we're not driving an appropriate amount of it. So we can't learn to calm our threat response down. So we can't learn to connect. Now, how many of the kids that you're seeing in the last 20 years fail to be able to have a partner effectively? They haven't learned to connect. And like the data on just tongue ties coming through is at least a third of the Western population, especially of Viking and Celtic ancestries, are going to have these problems.
Oh, so I was just thinking, we just did another binge watch of the Viking series on the History Channel.
Yeah.
And how hard was that like?
Well,
But
absolutely.
that's really what we're built for. That's how we're supposed to be living.
However, a lot of those things are really interesting, that there's a lot more technology and an easier life that they had in there than we're actually... They tend to keep the conditions a lot more squalid than the true actual archaeological references.
Really?
Yeah, for a lot of the different populations. We're making up the stories as we go along, but that's kind of off topic. But at a basic level...
Well, we'll have to do another podcast because now I'm dying.
At a basic level, they were just vastly more physical in their actions and their activities, and they had stronger bodies and stronger posturing.
Absolutely.
And, like, unfortunately, like you get to see the different kind of movies that, like, kids at high school were playing literally on high bars in the 50s and the 60s, dangling, and they could do chin-ups, etc. And now we celebrate kind of sports athletes and give them $180 million contracts, etc., because they're now the exception, as against doing that stuff was normal in the 50s. Now, obviously, there were still exceptions to that, and we still had football and basketball stars. I'm not saying that people aren't exceptional, but they are more exceptional now because we don't have bodies that work well. We are becoming neophytes. All of the people
and
look like
fat.
babies. That's it.
And we're fat, yeah. These kids, childhood diabetes, and and kids don't even have to chew anymore. Now you got kids sucking mush out of bags.
Yes.
Oh,
however,
my God.
I've got data from about 1914-ish, somewhere there, that I've read, that they were already saying that we were eating too much pappy, sloppy food at that stage in the beginning of the orthodyspraxia, bad bite stuff. So, like, I've got a paper from 1921 going into my book that basically says that the appropriate age to correct the inappropriate bite mechanisms is 4 to 7 years of age. So they were already having lots of problems with oral airway dysfunctions, etc. at that point. Now, what two things had majorly changed in people's lives by 1921, 1922 in, say, the United States?
Well, we were past the First World War.
Yeah.
People were living in cities more.
True.
Cars, automobiles.
Nope.
No?
Okay. So somewhere about 1887, we developed our first kind of evil foods, which were industrialized oils. The edible oil industry got birthed around then.
Yes, yes.
And by 1911, we had Crisco, and then you guys turned into idiots after your president had a heart attack and everyone started to listen to Ansel Keys, which was a bad mistake. So the oils were severe, and they drive diabetes and they drive heart disease, and you're never going to get out of Dodge until you get those things out of your food. It's just not going to do you any good. So when did the electric light bulb and electricity change your world? Again, World Fair, Chicago, somewhere about 1870-ish, right? And so, as I said before, electric light changes your sleep cycles, changes your REM fields of sleep, changes your growth trajectories. These things alter how the body develops, full stop. And the greater the amount of exposure, again, every structure in you is a polar protein structure. The shafts of your bones all are filled with protein. Your skin, your hair, it's all protein. So if you bend those proteins, they don't work for you. Your enzymes that make things work are affected by the electromagnetic fields that we bathe ourselves in. So that was starting to get weird by like 1922.
Wow.
Okay, it's only got worse. So it's about 100,000 times worse at this moment, or in some of the data that I have, like 2019, compared to where it was at, for electrosmog. This is the amount of dirty electric fields from all things since 1950. 100,000 times more electromagnetic garbage in our environment affecting us.
Wow.
So, yeah, we are...
What do we do? What are we going to do?
I don't know. All I can do is I can raise these things for people and get them to start to think and go, do I really need that light on? Should I be exposing myself? Should I look at like color therapy, which is one of the things that I use with patients to try and alter their electromagnetic fields? Should we turn off the screens more? Should we... And you need to try and simplify your life a whole lot more. Like, again, if we think about kind of the neuro-emotional links, what we've been told since the end of World War II is that you're an empty husk of a person who needs to fill that hole with bullshit consumerism and buy more stuff, right? And what we actually need to do is we need to be connecting to people and having more sitting around the campfire, singing and eating and laughing and doing things, not, I'm on my phone, this is fun. You know, like
right?
I sat... as it turns out, from a political bent, I am what's probably considered a anarcho-libertarian. My viewpoint is we need to kind of burn the whole system down and get rid of the rampant theft of buying power and purchasing power from people in the last 80 years. We need to actually make a greater degree of egalitarian society where people are not tricked into trying to fill the emptiness with stuff, because it doesn't work. And we're not going to make healthier people when everywhere there is vast amounts of cheap plastic garbage that is full of toxins that goes into people, that is creating cancers, it's creating tongue-tie dysfunctions, it's creating heart disease. These include the edible oils, and one of the worst things is your water supply. Because water, if you get on top of it, there's a great book out there that frightens people called The Fourth Phase of Water. And one of the things that I learned in it is that water is a universal solvent. It will pick up whatever it is in. If it's in plastic, it picks up the chemicals from the plastic. And then where does it take it?
Into us.
Yeah. So we're doing these really wonderful things. We clean up our water by putting like fluoride in it and chlorine in it, right? Those things are noted neurotoxins. They are very good antibiotics. They kill the bacteria in the water. Supposedly that's really good. And then we forget that they keep killing stuff when you put it into you. And they'll say, but it's not enough to kill you. Yeah, but it is enough to kill your gut bacteria. And if it kills your gut bacteria, then your symbiosis for making serotonin and, vitamin K and a whole bunch of these really important neurotransmitter chemicals, we just ablated them, which can cause leaky gut and cause you to wind up your gut immune system and starts making disease. Are we making, I'm not saying we shouldn't be cleaning our water. What I'm suggesting is maybe we need to think about this. You could put ozone into the water to kill it and purify all the bugs, etc., right? You could put hydrogen peroxide. There are other ways of doing these things that you don't have to go for the cheapest, most profitable way that might have a negative impact on future generations. Because one of the things that I learned in the last decade or so that everyone kind of brushes over is whatever bacteria mum has, she gives to her kids. So whatever bacteria you don't have is gone. You don't get them back. There's no, we'll get them on the next round. If you've killed them, then you are not giving them to your child in utero or through the birthing process. So they are gone and they are affecting how we exist in this world forever.
Right? And what are dentists telling people to do is rinse with Listerine, which is like napalm for the mouth. Because, we know enough to know that pregnant women, have more gum disease. So what do? We scrape the crap out of their gums, and then we have them rinsing with Listerine and using these toothpaste that it just wipes it out. And oh my God, I didn't think about, once it's gone, it's gone. So
it's
you
gone.
Can't even...
No, it's not coming back. So what you then have to think about is why would women who are pregnant have issues with gum disease? What are they not able to do so well when they're pregnant?
Well,
breathe.
Brush
Breathe.
their teeth.
Breathe. Just think simple. You've got a lump sitting underneath your diaphragm that is making it hard for you to breathe, so you are not taking in as much stuff because your sinuses don't work properly. Right? So if you can't get enough air in through here because this isn't working, so you just take short gasping breaths. Now the problem with that is the shorter and sharper your breathing rate is, the more your nervous system believes you are running from a bear, the more adrenaline cortisol hits the bloodstream, the more that releases calcium, the more you tighten up your musculature, making it harder for you to breathe. And then you have to throw magnesium at the calcium to counterbalance it, which means you don't have enough magnesium and you end up in the place of preeclampsia.
Wow.
It's kind of fun, isn't it?
Yeah, no, it's amazing. And, but also, when I was, my daughter's 33.
Yeah.
So when I was pregnant with her, there was a lot of focus on adequate protein intake to prevent preeclampsia. So I ate a ton of peanut butter.
Well,
but because I didn't know what I didn't know back then. I knew that protein was, peanut butter had protein.
Yeah.
So
full of lectins too.
So, and there's also some, so these oral bacteria, they're in your bloodstream.
Sure.
And dentists think that the mouth and the body are separate for some reason. But this oral bacteria, it's in your bloodstream. My theory, is that early humans had their mouths closed all the time unless they were eating.
Pretty much.
They were mouth breathers. And that having, like we've already said, everything is about survival.
Yeah.
So if the mouth, if the tongue is what we use to explore the world,
yes,
the mouth has to be connected directly to the bloodstream in order for whatever goes on the tongue the rest of your body's got to know really fast.
Okay, so there's a couple of things to that. There's several parts that I think are right, but
good.
the more stressed you are, the more the adrenaline causes the gap junctions and tight junctions in the gut lining to slide apart and break, which means that whatever you've swallowed from the mouth goes across the wall into the bloodstream. That's how it works. So the more mouth breathing you do, as I said, the more your brain believes you're in a fight-flight state, the more chemical it releases to help you survive. So the more you occlude your airway at night, the more stressed you are, the more gut leaking, irritable bowel you will develop. Secondly, in the gut itself, you have what are called immunoglobulin A, which is released from the intestinal cells. And what it does is it comes out and it binds pieces of protein that are available, including bacteria, including foods, etc. And they take it into the system and they say, this is normal because we found it. You are not meant to react to this. And this is where some of our chronic illness comes from. Because if you keep seeing fragments of staph or strep that shouldn't be there in your gut because you are swallowing it because... Right? And that starts, think of how many people, like I did when I was inappropriately wrong when my kids were little, they go, oh, isn't it cute?
Right.
Right?
The videos. I so cute.
Yeah, no.
My story to the point that's what sleeping people do.
Yeah. All bad. So what they're doing is they're sucking in all the bacteria, swallowing it down, and then it's getting taken into their systems and they don't respond to it appropriately because they train their immune system to look at these bacteria that then later on are going to eat them out of house and home and create like pandas. Because if you don't know how to respond to it appropriately as if it shouldn't be there, you develop bad problems. So yes, there is an instantaneous response, but that instantaneous response is more to do with chemoceptiveness and neural response, not bloodstream response. Blood is slow. Okay. Biochemistry is slow. Nerve is instantaneous. Wow, between...
So I was on the right track.
Yeah, you're on the right track, but you got to think what's faster. So, like in medicine, neurological change, which is where craniosacral, chiropractic neurology, functional neurorehabilitation, these are things like if you touch there, you get the sensation of it in your brain instantaneously, right?
Yes.
So it's somewhere between 150 and 350 milliseconds, right? So if I do something to try and mobilize the brain to release serotonin, if that was at all possible, it will start from when you do it 350 milliseconds after you start doing the thing to change the brain, because all input changes the brain. Bloodstream for, say, an antidepressant takes about 6 weeks because you have to dissolve it. So what I'm trying to get people to understand is that bloodstream and biochemistry is neither good nor bad. It's just slow. And everything that we do that involves touch and sensation and sound and lick and all the things that are part of our sensorium are near-on instantaneous. You put a chemical on your tongue, whether it's a sugar or a salt or whatever, your brain heard that within half a second. So we need to be doing things that are increasing or decreasing tone in the nervous system to get harmony back to the nervous system, not relying on chemicals and biochemistry because it's slow and old. But it makes a lot of money.
Yes, it does. Oh, well, the healthcare, what a joke. It's disease management.
Yes.
I don't know if Australia is as bad as the United States.
Different, but like we have something called Medicare, which I know you guys have, but it's slightly different. So almost all medicine has some degree of government involvement and payment in it here. Right? And we look at it and say socialized medicine's the best thing in the world. But in my opinion, I think it's led us up a garden path because it emphasizes the benefits of drugs and surgery and hospital care and medical doctor's office care. And the payers of that, which is a non-government, quasi-government entity over here that is accountants, tell the doctors what they're allowed to do and what they're not allowed to do, which sets the standard of care. Then the regulatory boards work in what I consider collusion with them to say, you are naughty, you did too many of that test or gave too much of that drug. Right. We don't approve of that. Yes, but it was relevant to the patient. No, you're against, it's not patient-centered healthcare anymore. And so while there's benefits because people don't go bankrupt trying to afford medical care if they get smashed up in an auto accident. So there's parts of it that I love, which I think everyone should have the access to not dying if you get shot or in an auto accident, right? Yes. I want the system to be fair and even-handed, that it looks at preventative care, tongue ties, oral airway problems, breathing problems, as primary focus, so we're not trying to push the people back up over the cliff again. We've got these wonderful things, and I use the example of diabetes with my patients. Like the standard test for diabetes, you haven't gone, your HbA1c is not past this point, which is like 6. Right? So what we're doing is we're saying to the patient, you haven't stepped over the cliff yet, you're fine. Don't worry, we'll tell you when you step over the cliff. We'll do something when you're on the way to dying.
Right. Ah!
Yeah. That just doesn't make any logical sense. You should be saying to the patient, hang on a tick, that is in a pattern going in the wrong direction. We need to stop you.
Back away from the cliff.
What is wrong with your metabolism? Why is this occurring? But secret to that one, I keep talking about seed oils, etc. Oral airway functional maldevelopment syndrome, fragmentation of sleep and airway will drive diabetes full stop, because the amount of cortisol going into the system pushes your blood sugar up, which causes you to release the insulin, which causes you to put on mid-body weight gain, which increases metabolic syndrome. So fragmentation of sleep, airway, hypopneas, apnea, snoring drives diabetes. Full stop. But we treat these things as separate. We go, see, you're a bad person who's got bad willpower. Stop eating, fatty. No, because the more fat you get, the harder it is to breathe properly. And therefore, the original problem gets worse. So primary prevention is get people's breathing and airway and sinuses to work properly.
Yeah. Yes. And so that's really it. It's the breath. We have to teach children to nasal breathe early. We have to make sure that their nasal system is functional.
Yeah.
And, that's really the key.
And move their tongue. Get them to use it.
Move their tongue.
Yes. This is where, like, kids have to learn to kiss properly. Later on a bit. But, like, that's purposeful movement of the tongue, isn't it?
That's right.
See,
then all that bacteria, ew.
Well, you got to share the bacteria. You got to taste the world and work out what's safe. But like, this is a personal thing. My kids are kind of late teenage, etc. And like, oh no, kissing. Like it's like, hang on a sec. Where did I go wrong here?
Oh, they'll figure it out.
Let's hope.
Oh yeah. Well, the hormones will take over. So, we have been talking for over an hour.
Yeah.
And I could talk to you all night. But in podcast,
people time out. They do.
They do. And I can't wait to watch this again because you have given me so much education. And I thank you.
You're most welcome. If anyone wants to see that in person, I will be presenting in San Francisco at the World Sleep Dentofacial Congress in November. Mm-hmm. And since I'll be there, if anyone wants to organize me to talk in person after the fact, I'm more than happy to.
What are the dates in San Francisco?
I think it's like the 10th, the 13th, or something like that. I'm not so bright as to remember these things all by myself.
Oh, right. No. All right. Well, I'm going to get your book. And,
fantastic.
And I can't thank you enough for meeting with me and providing so much information. And, whoever watches this is going to be amazed and they're going to be very educated. And that's really my goal. I want to bring these topics to the attention of my fellow dental professionals.
Absolutely. And as I say, I'm more than happy at any time. If we want to do more, we can do them live. I can present in any which way you want. I agree with you. I think we need people to understand that it's more than just a box here of get the bite to look pretty. Oh, that's an annoying tongue. It's human, right? If the tongue doesn't work properly, the system doesn't work properly.
So thank you again. And I think I probably will do a live with you.
Beautiful.
So let me turn off this recording.
Recording stopped.
Thank you so much.
You're welcome.
I hope I didn't sound too stupid.
No, that's okay. Most people don't understand what I've looked at for the last while. And so I usually sound as I do because this is my passion area, and most people go, oh, I hadn't thought of it that way. So no, you are just fine. And like I caught up with JJ for the first time in the airport as we'd just flown in, him from Malaysia, me from Brisbane to Melbourne. And again, he just literally credited me in a presentation he gave to obstetrics and gynecologists.
He mentioned that on Facebook. Yep.
Yeah. Because I come at the whole thing from a very different angle. And I look at the epigenetics and the neurology as the primary thing that we have to alter in people.
Well, my mentor, Shirley Gutkowski, is she... you and she are exactly simpatico with your.
Well, that's cool.
With your, your interests, and I'm going to make sure that she knows your name. And so, yes.
Excellent. Well, I'm very pleased that I could help in some way.
And I will look forward to speaking with you. And who knows, maybe our paths will cross someday.
Well, as I said, you can always come to the Congress. I'll be there. I get 20 minutes to talk on. I'm going to present a couple of cases of functional neurological disorder that were corrected by tongue tie release.
Wow. Okay.
And I'm going to present my daughter, who about 50% of her ADHD symptoms stopped literally overnight. Overnight. We had the tongue tie release. She was a different person the next morning after sleep.
Oh my God, that's amazing.
Because what did she do for the first time? She slept. So her threat response went down.
Yes. People need to hear this.
I agree.
All right. Well,
Right.
Good morning, good night.
I shall go to work in a minute. Well, I'm technically at work, but I'm going to see people in about 20 minutes.
Okay, great. I hope you have a beautiful day.
Thank you. You have fun.
Okay, thanks.
Bye.